Have you ever heard of recurrent respiratory papillomatosis? It's a bit of a mouthful, but it's actually a rare disease that can have a big impact on people's lives. Let me break it down for you. Recurrent respiratory papillomatosis, or RRP, is a condition where benign tumors, called papillomas, grow inside the airways, usually in the larynx or voice box. These growths are caused by certain types of human papillomavirus, or HPV. They can make it really hard to breathe, speak, or even swallow. In severe cases, they can block the airway, which is pretty scary. Traditionally, treating RRP means repeated surgeries to remove the growths, but surgery isn't a cure. The papillomas often come back, and each operation carries its own risks. Imagine having to go through that over and over again. It's exhausting and stressful. But here's where things get really interesting. There's a new treatment called Papzimeos. Yeah, it's a bit of a tongue twister. The scientific name is zopapogene imadenovec durba. What makes Papzimeos different? It's not another surgery, and it's not your usual medication. It's actually an immunotherapy. It uses some pretty cutting-edge science to help your immune system recognize the problem. Papzimeos is based on something called a non-replicating adenoviral vector. In plain English, that means scientists took a harmless virus, one that cannot make copies of itself in your body, and engineered it to deliver specific genetic instructions. Think of it like a delivery truck carrying a very important package straight to your cells. When Papzimeos is given, the adenoviral vector carries a gene straight into the papilloma cells. This gene tells the cells to make a special protein that basically waves a flag for your immune system. Hey, attack this cell! Your immune system, which usually struggles to spot the papilloma cells, suddenly knows exactly where to go and what to do. The result? The immune system targets and destroys the papilloma cells, reducing growth and hopefully keeping them from coming back. Now, because Papzimeos is non-replicating, it can't multiply in your body, so the treatment is targeted and controlled. This approach represents a whole new way to fight RRP, potentially fewer surgeries, fewer recurrences, and a much better quality of life for people living with this disease. Of course, like any treatment, Papzimeos isn't perfect for everyone. It's important to talk to your doctor about the risks and benefits. Make sure you review options, side effects, and follow-up care with your clinical team. But for adults battling recurrent respiratory papillomatosis, this new immunotherapy could be a real game changer. That's a quick look at how Papzimeos is bringing hope and science together to tackle a tough disease. If you learned something new today, hit that like button and share this with anyone who might benefit. Thanks for watching, and stay curious.